Hello viewers. The prostate is a small gland situated just beneath the bladder and plays a critical role in male reproductive health. Yet it often escapes our attention until problems begin to surface. As men age, the likelihood of facing issues such as prostate enlargement, inflammation, or even prostate cancer increases significantly. While certain factors like aging and genetics are beyond our control, there is one powerful element we can influence directly: our diet. What we eat daily doesn't just nourish us, it shapes the long-term health of organs like the prostate. Certain foods, if consumed frequently or in excess, can contribute to inflammation, hormonal disruption, and even cellular damage in the prostate, which over time may lead to serious health conditions. Though these effects may not be immediate, the cumulative impact can be profound. In today's discussion, we'll explore various dietary choices that could be harmful to prostate health, and explain how these foods gradually exert their influence on this vital gland. It is crucial to pay attention because the changes often go unnoticed until symptoms become disruptive. Let's begin by looking at how certain processed red meats, such as bacon, sausages, and hot dogs, pose a threat. These foods are high in saturated fats, which can elevate estrogen levels in the male body while reducing testosterone. While testosterone is vital for prostate function, an imbalance favoring estrogen can stimulate abnormal growth in prostate's tissue, increasing the likelihood of benign prostatic hyperplasia, commonly known as BPH. Additionally, processed meats often contain preservatives like nitrates, which can convert into carcinogenic compounds called nitrosamines during digestion. These compounds are capable of altering cellular DNA, and long-term exposure increases the risk of mutations that may eventually lead to cancer. Cooking these meats at high temperatures also produces advanced glycation end products, or AGEs, which further exacerbate inflammation throughout the body. Chronic inflammation creates oxidative stress that damages the prostate over time, weakening its resilience and paving the way for tissue changes or malignancy. This inflammation also contributes to urinary issues by creating pressure and irritation in nearby areas. Moving on to dairy products, we find that milk, butter, and cheese, especially those high in saturated fat, can affect prostate health in similar ways. These fats not only raise cholesterol, but also reduce blood circulation, thereby depriving the prostate of essential oxygen and nutrients. A poorly nourished prostate becomes more vulnerable to damage and abnormal growth. Excessive calcium intake from dairy may also suppress levels of calcitriol, a form of vitamin D that helps regulate cell proliferation in the prostate. Without sufficient calcitriol, the body's ability to control abnormal cell growth diminishes, increasing cancer risk. Furthermore, dairy contains insulin-like growth factor, or IGF-1, a hormone linked to higher rates of cell division. Elevated IGF-1 levels have been correlated with increased chances of developing prostate cancer because they promote rapid cellular replication without appropriate regulation. Then there's alcohol, a substance that many enjoy socially, but one that can silently undermine prostate health. Alcohol consumption can disrupt hormonal balance by increasing estrogen levels while lowering testosterone. This hormonal disturbance contributes not only to prostate enlargement, but also to the progression of existing conditions such as BPH. Moreover, alcohol strains liver function, reducing its ability to detoxify the body effectively. A sluggish liver leads to a buildup of toxins, which can irritate the urinary tract and prostate. Alcohol's diuretic properties also result in dehydration, concentrating the urine and making it more irritating to both the bladder and prostate. This increases urinary urgency, frequency, and discomfort. Symptoms that are especially problematic for those already dealing with prostate enlargement. Fried foods represent another group that's damaging to the prostate due to their trans fat content. These unhealthy fats not only raise levels of harmful LDL cholesterol, but also lower beneficial HDL cholesterol. The resulting imbalance impairs overall circulation, including blood flow to the prostate. Poor blood flow means less oxygen and nutrients reach the gland, which hampers its ability to repair and maintain itself. On top of this CA'd foods generate AGEs during high heat cooking, just like processed meats. These AGEs trigger systemic inflammation and oxidative stress, key contributors to the deterioration of prostate cells. The inflammation can become chronic, weakening prostate tissue and leaving it more susceptible to conditions such as BPH and even cancer. Spicy foods, while enjoyed by many for their flavor, can also negatively affect the prostate, especially in those who are already experiencing urinary or prostate issues. Capsaicin, the compound responsible for the heat in spicy foods, can irritate the bladder and urinary tract. This irritation often extends to the prostate, triggering symptoms like increased urinary frequency and discomfort. Spicy foods can also cause mild dehydration due to their thermogenic effect on the body, leading to more concentrated urine. This concentration can further irritate sensitive urinary pathways and exacerbate symptoms in men with an enlarged or inflamed prostate. It becomes a cycle of irritation, inflammation, and worsening symptoms that is hard to break without dietary changes. Caffeine, present in coffee, tea, and many soft drinks, is another substance that poses risks. As a stimulant, caffeine increases the activity of the bladder and the entire urinary system, leading to more frequent urges to urinate. For men with prostate issues, this can significantly affect quality of life, especially if the flow of urine is already restricted due to an enlarged prostate. Caffeine is also a diuretic, meaning it promotes fluid loss and potential dehydration. Dehydration makes urine more acidic and concentrated, increasing irritation of the bladder and prostate. Again. Furthermore, caffeine has been linked to increased systemic inflammation, which may aggravate prostatitis and potentially heighten long-term cancer risk. Sodium, or salt, is another commonly overlooked contributor to prostate problems. A high sodium diet, especially from processed foods like canned soups and fast food, can lead to water retention. This extra fluid puts additional pressure on the bladder and urinary system, indirectly affecting the prostate. This is particularly problematic for men with BPH, as the increased urinary frequency and urgency become harder to manage. High sodium intake also raises blood pressure, which can impair microcirculation, including the tiny blood vessels supplying the prostate. Over time, this reduced blood flow can damage prostate tissue and make it more prone to dysfunction. When discussing sugar, it's important to recognize its widespread presence in modern diets and its silent but significant effects on the prostate. Consuming too much sugar, especially from refined products like sweets, sugary drinks, and baked goods, causes repeated spikes in blood glucose levels. This can eventually lead to insulin resistance and obesity, both of which are strongly linked to an increased risk of prostate enlargement and cancer. Hormonal imbalances caused by insulin resistance, such as increased estrogen and decreased testosterone, promote abnormal growth in the prostate. In addition, excess sugar fuels the production of free radicals, contributing to oxidative stress and damaging DNA within prostate cells. Over time, this cellular damage accumulates and raises the likelihood of mutations and disease. Finally, refined grains like white bread, pasta, and white rice may seem harmless, but can impact prostate health by rapidly converting to sugar during digestion. This causes blood sugar spikes similar to those caused by sugary foods, setting the stage for insulin resistance and inflammation. Moreover, these grains are stripped of fiber, which is essential for stabilizing blood sugar and promoting metabolic health. Without fiber, the body has a harder time managing glucose levels, and chronic elevation in insulin can create the kind of hormonal environment that fosters prostate enlargement and dysfunction. All of these dietary choices may not seem alarming in isolation, but their long-term cumulative effect on the prostate is real and significant. A diet rich in processed meats, dairy, alcohol, fried foods, spicy meals, caffeine, sodium, sugar, and refined grains can gradually compromise prostate function and structure. Over time, this may lead to an array of symptoms, including increased frequency of urination, weak or interrupted urine stream, a feeling of incomplete emptying, pelvic discomfort, and, in more severe cases, the development of cancerous cells. It's important to be mindful of these symptoms and to recognize them as potential early warning signs that your prostate may be in trouble. While lifestyle changes like diet can't guarantee immunity from prostate issues, they do play a powerful role in prevention and management. By choosing to reduce or eliminate these harmful foods, you give your prostate the support it needs to function optimally well into old age. Whether you're already experiencing symptoms or simply looking to maintain good health, paying close attention to what you eat can make all the difference. So stay informed, eat wisely, and don't ignore the signals your body sends you. Because when it comes to prostate health, prevention is always better than cure.